Hi, everybody. AJ Heitman here with GEMS, and this is the EMS Today show. And very special guest today, Todd Stout, who is the founder and president of FirstWatch. And welcome, Todd.
Hi, thanks, AJ.
I especially wanted to have you on the show because it was probably 2003, and GEMS gave you a forward-looking thumbs up for the FirstWatch software and its pandemic or surveillance capabilities, and you know, it was basically a thumbs up for having all of the data brought together collectively, analyzed, have a dashboard. I understood the whole concept, and then one portion of that was, what if this would happen? What if, and we saw that with the wildfires, smoke blows into a different neighborhood and we start to see an increase there. So would you explain just a little bit for our listening audience what the FirstWatch software is? Because you have, you know, probably about 45% of the US population is covered by FirstWatch right now, and about 500 agencies. So it is a household name in the business, but many of the providers don't realize what the capability is of those 500 agencies that are looking at it right now.
You bet. I appreciate it. So what FirstWatch does, most systems have some kind of dispatch software to capture the information. They have ProQA, call taking software. They'll have, and most people now have electronic patient care record charting software. And all that software is built to make it easy to take calls and dispatch systems and hopefully make it as easy as possible to document patient care. But very few of them have analytics that work in a simple enough way for most people to use. So what we do is we sit on top of those systems and we monitor them in real time. And we've done that since 1998 in Kansas City, where I was actually a stock boy and an EMT and a paramedic and a flight medic. And they were one of my first customers when I went out on my own and started doing reports. And their public health director there, Dr. Rex Archer at the time, asked if we could monitor their dispatch data for trends or patterns that could indicate a weapon of mass destruction. And then, now, granted, this is 1998, 1999, before 9/11, and you know, I didn't have any idea what they were talking about, but thought, oh, sure, I'd be happy to help them. And we put together this tool that would watch for statistically significant increases and send alerts. And after 9/11 and the anthrax letters went out, there was some grant money that people had. My report customers asked me to create this product. A name you'll be familiar with, Jerry Overton, was running the Richmond Ambulance Authority in Virginia. He happened to be in Kansas City at the beginning of winter when it went off. And he said, well, this is really a public health surveillance tool. It's not just a bioterrorism tool, and convinced me to make it into a product. And so I rolled it out with a buddy of mine, and John Washko, who's since moved on and is no longer part of the company, but he helped get things started. And we rolled it out as this tool just to monitor for that. And over time, you know, my background with my dad's time in EMS has always been more operational and making things work better. And so over time, it evolved from a biosurveillance tool to an operational tool. And, you know, we help people with everything from response times to quality improvement. And the kind of the biosurveillance stuff has always been this low-level thing we did. It caused us to be able to help with H1N1, to be able to help with Ebola, and again with COVID-19 now. And you know, everything comes around full circle, that's for sure.
So with Ebola, for example, if a crew was responding and it came up in the screen that the person had been traveling and was coming from Africa, that would trigger them to alert the crew, and you know, that kind of evolved. So you had a bunch of triggers that were set up for Ebola, and when all of a sudden now COVID hits, what was your reaction? Did you take those triggers and expand them?
Yep, that's exactly what we did. We reached out to customers. We talked about what was coming. This sort of looks as a disease, a little more like SARS because it's a variation, or like H1N1, but the way that you could surveil it was more like Ebola, in that with H1N1, it started in Mexico and it spread really fast. So the travel component was only worth about a week's worth of effort. With Ebola, we were looking at travel from various countries and all the different possible misspellings of various countries as you do it. So we repurposed those Ebola triggers because people had kept them in place because Ebola is still an issue, just not here, thankfully. And we repurposed them so that it was travel originally from the Wuhan area of China. And then as it spread, we started to add more to that and symptoms. And we told people the travel component is not going to continue to be an issue, but you can use it for now. And then as the travel component became, the COVID-19 became almost everywhere. Now, a few places still ask about if you have somebody who's known to have COVID, but otherwise travel's not really it. But really, we just took what we've learned for 21 years and applied it for those triggers. And we now have over 180 different systems that we monitor in one way or multiple ways for COVID patients.
So tell me some of those triggers. If I'm a paramedic, what are the triggers I need to understand that are, and that's really what's important about us talking here, is that as a paramedic or a supervisor, I sometimes don't know that this umbrella, this FirstWatch umbrella, is over me. So tell me a couple of those 180.
That's a great question. Some great examples, especially early on. Right now, if you have PPE and you're not wearing it, you should be. But early on, people were handling things differently. And even now, if they don't have a lot of PPE, they're having to choose when. So what we'll do is we'll actually monitor that dispatch data and notify if something is entered that causes us to think that it's a potential COVID patient based on the symptoms, based on keywords in the comments, and that'll notify. And that's helped in a number of places. One of our customers is in Middlesex, London, in Ontario, Canada, and they reported that there were times when dispatch was so busy they didn't notify the crew. They couldn't get to notify the crew in time while they were on their way to these calls, and the supervisor would pick up and realize that he didn't hear them tell the crew that it was a potential COVID patient, and he or she would then call the crew to notify them, and it prevented some people going into scenes not realizing it could be a potential COVID patient.
And the supervisor would know that because the screen would tell them that FirstWatch picked up on that.
Yep. Their phone would get on a text alert or in their FirstWatch app, and it would let them know. And now it's more all kinds of things. Situational awareness. Where are our potential COVID patients in the community? Are we returning to an address where previously we had a patient, whether we transported or not, that we thought had COVID-19? So maybe the second crew going in isn't aware that they were there before. It didn't get entered into the CAD in some way. A lot of geographic sensing of those patients. A lot of people are tracking a homeless patient, so you can't really do that by address. You have to do that as a combination of the CAD and the electronic patient care record data. So it's super interesting. We've done so many different ways that people are watching and seeing. When they were bringing in people from cruise ships and evacuating them in, or people who are being repatriated from outside of the States, we would monitor some of our customers, AMR, Jimmy Pearson's shop up in Solano County, that were able to use us to help them keep track of just their activity. When things are moving so fast, it's hard to know the information. And it's not really great to go to city council or county commission and say, we're just real busy, help us out. They want data in order to try to do more for you, and we can help with that.
So one of your customers is FDNY, am I right?
Yes, sir.
So they've had a tremendous increase in call volume. Do we know why that's happening? Is it just that the callers are getting paranoid as soon as they start to feel like they have something?
My belief is that they're just on top of each other. It's so close in New York City, and everybody's on top of each other. It's hard to be socially distant in a place with that many people in such a small place. And I think that's a lot of it. I think also they got hit pretty early, and there's so many people. You know, by the time the rest of us were hearing about it in different states and different communities, you know, it was already, you know, blown up there. There's a lot of good work. We're lucky enough to have New Orleans as a customer as well, and you know, they weren't too far behind them, and they're all you know, working hard and really struggling to kind of just keep up with the pace of it, getting things like, you know, twice as many calls in a day as they ever have. And you know, you can do that. Every system I've ever worked in has had days like that where you have one, you know, crazy day. It's a horrible, you know, ice storm. It's a horrible something else. You've got a big, you know, special event in town that just kicks your butt. Think about that every single day, day after day after day, when your partners are sick and can't come in. So now you've got additional workload. You know, there's not very many of us in this business that are in it for anything other than the fact that we want to help people and we love it. So now you're trying to help more people with fewer resources, and you can't do as much. It's a really tough spot.
Now, if I'm on a crew and I run a couple of back-to-back shifts and different shifts, and I come down positive or come down ill, is there a way through your software to find out who I've worked with throughout the past 5, 6, 7 days?
Yeah, that was one of the things we did in the early days of the H1N1. Even though it didn't turn out to be such a big issue for EMS, people thought it was going to be like it is in New York City, with hospitals just completely full and no room to take anybody. And so, yeah, you can actually track back and say, okay, you know, AJ and Todd handled this patient, you know, BLS car accident 6 days ago. You know, who has AJ worked with since then? Who has Todd worked with since then? What patients have they seen? Where did they pick up and drop off those patients? Because both of those locations are now potentially at risk. Who did AJ work with on the shift after that? And who did I work with on the shift after that? It's from a computer perspective, is not that hard. From a you know, from a human perspective, it's rough. So we definitely do that. The things you don't get are, you know, did you stop at 7-Eleven to get some nachos and some chocolate milk like I used to, and which 7-Eleven did I stop at? But you can get a good head start on it.
So talk to me about some aha moments from your customers. Have you had agencies call up and say, oh my God, Todd, we never thought that we were going to find this out because of the software?
Yep.
Things that you're sharing with your staff or your staff is sharing with you.
Yeah, there's a lot of that. A lot of it is just knowing the information, because some people are overwhelmed and they can't get to the information. Some people feel like they're busy, but they don't have good numbers. Some people, it's giving them some comfort that they're not seeing what they're waiting to see, and they're not just counting on them to wake up in the morning and go, holy crap, it got busy last night. You know, the system will alert them. Probably you know, some of my favorites are the one that I mentioned, where the supervisors could notify the crew. Certainly reminding crews, being able to track PPE is a big issue. Whether people are tracking that they wore it, whether people are tracking that they had to burn it, you know, had to get rid of it because it got contaminated on that call. Most places are not, sorry about that, most places are not able to just use PPE like we used to. And so they're actually having to document that they not only used it, but that they could not reuse it. And they're doing that in a variety of different ways, often in the notes or narrative of the call. And that's the thing we'll pull out by free text. We're doing a lot of monitoring the data the way people want to. How does this dispatch center document that it's a COVID possible patient? How does this agency document in the narrative that it's a COVID possible patient? And they're not doing it a standard way at all. And in our way, we kind of apply our framework and make it fit. Those are the big deals. Certainly the geographic components of it. We're also helping a lot with homeless and shelter populations, so that if they have a shelter set up for people, they can easily track calls in and out of that shelter. So when somebody comes down with a with COVID at one of those shelters. They know at least who else was transported. So it's really, there's sort of almost this infinite amount of things that people are doing based upon the data that they're entering. It's from a nerd perspective, it's really fun. From a human perspective, it's really sad.
So, obviously First Watch is known as for the analytics and for the umbrella and the monitoring and in real time, but you're also big into education. And with guys like you and Tegman out there presenting, I know Mike's been on an awful lot of webcasts, and you're running webcasts, and you also have some bulletins that people can get for free. Am I correct?
Yeah, absolutely. That's a big component of what we've done. We're focused mainly in two areas. One is helping people with resilience. We came out last year with our Resilient First product, which is kind of a system and an app to help people build their resilience, and the timing couldn't be better. Tegman's doing a lot of not commercials about the app at all, but just how to improve your resilience. And so that's been helpful because our crews and dispatch folks and the managers they're tired already, and we're just at the beginning of this. So that's really important to us. Also, we have on our website, firstwatch.net/HI. H stands for health and I for intelligence, health intelligence. We have pages that we've had up since H1N1 that really help translate previously in H1N1 and Ebola, sparse information for medical professionals into something specific for public safety and particularly EMS. This time around, it's really helping handle the giant deluge of information, the fire hose, if you will, of COVID-related information that's changing all the time, and kind of boil it down. So we have a COVID-specific section of the site where we try to put EMS-specific information there. We have a keeping your workforce safe section on there as well. And you can sign up, people can sign up for changes and notifications, and it's a big part. We do the webinars a lot with the Paramedic Chiefs of Canada and the International Academy of Emergency Dispatch because we're sharing those best practices. Our most recent one with PCC, Paramedic Chiefs of Canada, and IAAD, we had New Orleans and Snohomish County, Washington. New Orleans, which is overwhelmed, they've done a fabulous job on their call-taking process, and they're not responding to certain patients now because their system is overwhelmed. And Snohomish County, who has done a fabulous job, they had the first patient in North America. And so they've had a little more time than most of us to think about it and work on it. And Kurt Mills and his team and the folks there around Snohomish County have really probably thought as much about this in a logical and practical way of almost anybody. So it was really nice to get them and the director of the 911 center in New Orleans on there together, and they both have done really incredible work in a short period of time, and they were willing to share their lessons learned and best practices, which is how I learn the best. I don't, and learn from webinars is okay. Learning from other people who making the same mistakes I would is way better.
Yeah, and they're very gracious people. I was doing a lecture at EMS today, the end of March, and I emailed them and I said, hey, can you share any protocol or anything that you put together? And they sent it to me overnight, and I had it in my presentation and as a handout the next day. And then, who would have even thought that it was going to explode right after that? I mean, we were just so lucky that EMS today got out of there with, just really one exposure. One person came to EMS today who actually tested positive, was at a meeting on the 4th floor, but didn't infect anybody else. I think that, Resilience First was a great thing for you to do, an altruistic thing. It's a product, of course, generally designed for agencies, but now you've come out with a special deal because of the COVID, so that individuals that are really feeling stressed, they could buy into it and it's confidential, right?
Yep. Yeah. Completely anonymous. Only your stuff. So normally Resilient First, we sell to agencies, and we have ambassadors and whole kind of rollout programs that agencies have bought into. A number of them. It's pretty new, and it takes people a while to make a decision. But what we've done is we've come out with an individual offering for $15 for 90 days for people to get into it themselves. And basically what happens, you take this research validated test. It's only takes you just a few minutes. It's like 16 questions. You're honest with it because you're trying to help yourself. And then it gives you a sort of a customized few minutes a day on your phone or on your computer training program that is built with the idea that it's going to look at how you scored in these areas of resilience and help improve your resilience really a few minutes a day. And it's got some other features built in where if you're just super stressed out, it's not a crisis management tool. It's not a replacement for a therapist or, a chaplain or a peer support group, but it's to build your resilience. But you can sit down and it'll walk you through some breathing exercises, some meditation, some mindfulness type things. It's a really cool tool. I think it might've been you, I told recently, out of the 21 years we've been doing stuff, it's one of the things I'm most proud of, because I think of all the friends that we've lost over the years. And, I wish we had this. I think it should be great to get out there in public safety everywhere, but I'm even more interested in getting it into EMT and paramedic training programs. So people from the ground up can learn those resilient skills before they ever start to see the poop hitting the fan.
Well, I'm a big fan. I'm a big fan of debriefing and to helping people kind of cool down. But I'm really worried about this. I'm worried because I think that this is it's not. I'm not even going to call it post-traumatic stress. It's post-COVID stress. Like anything that we've worked in, you can work at an MCI. You could work for 24 hours and people just start to fall over at the end of those 24 hours. But and when I say fall over from exhaustion, just physical exhaustion. And then even after 9/11, the emotional exhaustion, some of it came 2 years later. But this isn't just a 2 or 3 day event. This isn't a week on the pile. This is an event where these guys and gals are going to work every day. And when it's over, which will probably be, I'm saying 6 months from now, they're still not going to trust. There's going to be a distrust. There's stress that they're seeing in the ER. There's stress that they're seeing with just the general public, with households. And so I think that it's an all-absorbing stress. So anybody I think that is really feeling that way, I would tell them to sign up. How much is it? $15?
$15 for 90 days. Yeah, we've got if you go to our website and I apologize, I should have been ready. I'll provide you with the link to it, but you can look at Resilient First at FirstWatch.net, and there's a link to it to go to an individual sign up page. Yeah, I agree with you, AJ. And I think the thing about it too is throughout our society right now, and it varies depending on the place, there is a level of stress just generally that I haven't seen since at least during the recession in 2007, 2008, as people were losing their homes and things like that. And then you pile, everybody's spouses that are not in healthcare, if they're not, or not in public safety, they're worried for their jobs. Their kids are home. They're trying to homeschool them. I mean, the level of pressure that normal people have right now is tremendous. And then you add our kind of work, our EMS work on there, where you're walking into people's homes, you're carrying people around. It's really, I think, going to mess some people up. And the stronger we can be when we start, stronger emotionally, more resilient we can be, the better off we will be. This is just not, you and I were talking earlier, it's a marathon. Is it a crazy ultra 100-mile marathon, or is it a Forrest Gump running across America marathon? It feels like it's a Forrest Gump to me.
Well, it's a marathon well beyond the time when everybody said, well, we need a vaccination or whatever it would happen to be. And by the time that comes out, it's going to take them 6 months to roll it out. You and I, when I was a kid, they gave us a sugar cube and we were fixed for whatever it was that they were giving me. I'm giving away my age, but the reality is it's going to be a good year and a half until people are really going to feel comfortable and on an ambulance, you're not going to feel comfortable. You're going to have PPE. There's anger out there. There's anger against organizations, against emergency management, against the government. Not enough PPE. Nobody envisioned that we were going to have to wear PPE on every single call. I mean, I could tell you from the days when I did ambulance inspections, people couldn't even find their N95 masks. They didn't know they had them.
Yeah, well, and you and I worked back before HIV, and when somebody had, we had to start wearing gloves, and we didn't even think that made any sense. And now it's everywhere, every time, and even then, people who are careful are still getting sick. And I think, to me, that's the toughest part. Is it's a thing that you can do everything right and still get sick, and it's, most of us would do it to ourselves to risk to help people. But when you're thinking about your risking your mom or your kids or your spouse or something like that, it's a whole nother level. I've just never seen anything like it so protracted over time before.
And I heard an account from one firefighter who said that his biggest fear is going home because he doesn't want to bring it home to his kids. And, that the clothes have to be changed before you walk in the door, and maybe changed again before you see your kids and they go to bed. So it's a really dangerous. It's an invisible death, and it's something that we have to worry about. So the real danger, I think, between people like you and I, is that we're hunkered in our homes and we're thinking. And so I'm making N95 masks out of Sam splints, and my wife comes home and says, "Oh my God, what's this contraption?" And I'm trying to be an inventor in some ways, just playing around with where do we go in the future. So where do you see the future here? I mean, as a data company, more agencies are going to finally wake up and realize that they need better analytics. You're probably seeing a whole bunch of things that have your mind clicking. Yesterday, I had them post that the Chinese have helmets that their police are wearing, that as they're looking at somebody 16 feet away, they can tell if they have a temperature. Hell, a year ago, I couldn't even get ambulances to carry thermometers. And now the cops are wearing thermal, visors down. And of course, in their country, it equates to the facial recognition. It uses AI, and it tells who that person is. It tells who they've been exposed to. So I don't think our country's going to go that way, but they are talking about having a system that comes up that follows where AJ's phone has been. And is that right or is that wrong? That's going to be a big question. If somebody could tell me that the restaurant you're going into has somebody that's COVID positive, I think I might like to know that. I'm wondering.
Yeah, it's really, I think it's really, first of all, the data is really helpful, and I'm really glad that we have it and can help. It helps in a lot of other ways. But yeah, those privacy issues are things I'm glad we don't head down those trails. One of our things is that our customer agencies always own their data, and not everybody in the industry feels that way anymore. But for me, I tend to be a little more privacy oriented myself. And I think if somebody gets my information, it should be because I gave it to them. But I do think those ways are, the ways of data. I also don't mind the fact that Google presents me with information I care about versus things I don't. So torn. And you're right. If I could choose to go to a safer place than a non-safer place, is not a lot different than the fact that you can look up. Maybe it is different. I don't know, but you can check out registered sex offenders when you're buying a house.
Yeah.
Where you draw that line is a thing that I'm glad it's not in my court. I'll tell you that.
Well, Apple and Google are working on something that they're going to unveil rather soon, and I think it's going to be an option that you can have. You can opt in to be alerted or not alerted, and I just posted an article about the Swiss air ambulance, and they have an app over there that tells people where, it can track you as you're walking through the mountains. And if you stop moving, it tells you if it stops, that you stop moving. And the Good Sam app that they're using in Great Britain is the same way. It helps out a cardiac arrest. So I really think things are going to change after this. I can tell you that, I think we were talking offline about the fact that 50 transit workers in New York have died And they're called first responders as well, because they're taking the nurses to the hospital in the morning. And 50 of them have died, more than the police officers in NYPD. It's just incredible that this thing can infect you that way.
It really is, and I think, like you said, it's invisible. It's insidious, and the idea that people without symptoms can have it feels weird to me in EMS. I'm used to responding to people that are sick, or at least feel sick enough to need some help. And that idea that my mom or my kid or I could be walking around as an infectious person without feeling any symptoms is part of what causes that everyday stress we're talking about. And it's just like when they started saying, hey, just because you're exposed to a COVID patient, we're going to keep you working until you show the signs of a symptom. And it's not that it's a great choice. It's just the only way to keep EMS running.
Well, I was thinking of something that I'm going to write for GEMS, and it was basically man down. The man down call, it takes on a whole different perspective today, because first of all, is it a man down because he has respiratory, because he has COVID positive? Is his wife standing next to him who has it? Are there 15, 20 people? How many calls have we gone to that's been a man down and there's a crowd around? So now the police are going to have to get those people back 15, 20 feet. They can't help us like they normally would, because they're all suspects. Everybody's a suspect.
Everybody is. And I mean, in some ways, I think it simplifies the work, in that when you go on a call, you have to be ready for it everywhere. You don't have to wonder, is this person or that person? You have to function like everybody is. The part that makes people angry that you talked about, though, is if I don't have enough PPE to do that. If I can't protect myself, I used to work in Kansas City, and they just had an EMT died that worked at Mass like I did before it went to the fire department. And he worked at Mass and at the fire department, and he was like you and me, not a spring chicken. He just died of COVID-19, and one of the things that his daughter found out from somebody else, because she couldn't be with him when he died, was that he was actually giving his PPE to his younger partners, because they had more life left than he did. And that's the kind of person, that's the kind of people a lot of us are, that we're blessed to work with. And, we shouldn't be in that spot. We shouldn't be in a place where you have to make that choice. And that's what makes it hard when everybody can be infectious and you can't protect yourself from everybody.
Well, number one, my message really to the people watching this and anything that we're doing is, if you don't have PPE, you got to talk about it. There's PPE out there, believe me. The government is doing everything they can. They're bringing boatloads of PPE into this country. I'm just not sure who's getting it. I'm just not sure if it's all being dumped on the hospitals, or, when I hear a big agency tell me they can't get enough N95 masks, there's something in the food chain that's not working, that we got to break apart.
Yeah, I agree, because I definitely talk with people and they have it. I think part of what I hear now is just that, because there is this perceived or real lack, then the prices are going up and going up and going up. And, I was talking with a guy the other day, and, he said you could get a, N95 mask for, a little over $1, $1.20 or so a piece previously. And now they're going for, $5.50 to $6.50 each. And is sort of, is that gouging? Is it just the price? If it was $25, would that be, where's that line? I can tell you, when this is all over, I'm not going to do anything about it now, but when this is all over, I'm going to have masks, in my garage. I'm going to have some toilet paper, and I'm not going to deal with it now, but I'm sure going to learn my lesson. And that's part of where you said, I think things won't go back to normal.
No, I think you're not going to find an N95 that's going to be made the same way, because I have a lot of friends that have told me that they pulled out their stash, even if it was just a couple cases of N95s. And I think we talked about this, all the elastic is gone. It just, whittles away. So there has to be a better material to use. I've been using industrial Velcro, and hot gluing that on to test it out, and it works just fine. But I think that's what we're going to have to look at in the future, is this, that nothing's going to be the same. There'll be a lot of after actions, and I think that's good. And I'll commit to what I do for GEMS to share as many of those pearls of wisdom that I can, and as many gadgets as I come up with, I'll be putting out there too. So save all your SAM splints for me. I'll be making N95s out of them.
I saw
it.
that's the best part for you, is all that stuff you've been hoarding all these years, you get to use now.
And I just go out to my garage.
Yeah, I know, that's the best part. It's evidence for your wife that this has all made sense all these years.
But she said, you have cases of toilet paper from back when we have to evacuate for wildfires. And I said, the problem is I can't find where they're at in the garage because there's all kinds of other junk in front of it.
Yeah, that is the hoarder problem. By the way, I remembered the URL. So it's firstwatch.net/RF. And there's a COVID looking scary link on there that you can go to for individuals. That'll teach people about it. And we're happy to help. Tegman, really is the sort of spirit guide of that. And back to this whole thing of, how do we prepare? And in your case, it's toilet paper and SAM splints. In hopefully everybody else can, at least as we come out of this on the other side, can use this to be, an opportunity to grow. I hope it causes people to learn, and we can do a better job. I'm a little worried that it might cause people to go ahead and actually leave the industry. And we've got a hard enough problem with finding good folks now.
Well, I hope not. And then my message for people is to keep busy. They talk about exercise is good for you. Well, in between shifts, cleaning your ambulance an extra couple times is also good for you too. There's, I know it's not downtime, but it's at least something to be able to do. So thank you again, Todd. Greatly appreciate you coming on, and please stay safe.
Thanks, you too. And what I've been telling people is stay healthy, and if you can't, recover quickly and well.
Thank you. Have a good night.
Thank you.